How are you? I'm good. I'm good. It's another week. Glad to be here. Be amongst the living. Oh goodness, I'm excited today. Okay, let's get this party started. So, welcome everybody. Welcome. Who's in the room over here? Janetta, welcome. Oh, I forgot to I'll do that while stuff is going on. Okay, I don't even know what that says, but welcome. welcome. So, welcome to the Saturday morning tea where we discuss health information, news, education, certification tips, entrepreneurship, starting that business. Lord, whatever. Oh, we got a doozy about some business today. Our special guest got something for you. She just dropped some tea on me probably 20 minutes ago. So if you are a nurse practitioner and you looking for a way to do some things in the entrepreneurial space additionally to clinical care, keep listening. Okay. I done spilled a little driblet of tea to keep folks listening. All right. We talk all the things. So welcome for being here. I am Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And first, let me ask you, do you know what it takes to be a certified marketable medical coder? Do you? I'm sure you do. Well, before I introduce my co-host, let me share with you information on a free 99 email course on the 5 steps to become a certified marketable medical coder.
Are you interested in medical coding, but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder.
All right. So if you are in Clubhouse, feel free to click the link that's pinned at the top of the page. If you are interested in getting more information about the 5 steps to become a certified marketable medical coder. If you are on YouTube, Facebook, and or LinkedIn, check out the video description for the link. I know there's a lot of information in that description. However, just scroll on down. You'll find it. It's in there. So joining me today is my co-host, Mr. Jesse, the illustrious Mr. Jesse, the registered trademark. Put some respect on that name, the coding nurse. So, sir, introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I live in Philly. I have been a nurse for a very long time. I switched over to HIM in 2014 during the pandemic. In 2020, I created a company called The Coding Nurse, LLC, where I help other nurses.
Bless you.
Thank you. Other nurses and people with clinical experience transition into the wonderful world of HIM.
Cool. And how is that working for you?
It's coming along. I am teaching PCS right now.
Oh.
We'll see how it's coming. That's all. It's coming.
And you know, PCS is a whole animal in and of itself. Lord Jesus. And wow. I'm sure that is all fun.
But before we start, I have to give an acknowledgement to one of my students named Kimmy in Texas.
All right.
Kimmy took my ICD-10-CM course back last summer.
Okay.
And she was like, I told her, I'm not going to have a CPT class because I don't have enough students. So she taught herself CPT and passed her exam last weekend on the first attempt.
Congratulations. Yes. All right. That's what's up. I love the go get itness, if that's a word, about her. Like, you know what? I'm not gonna let one monkey stop no show. I'm going. I have a goal in mind. I have something that I want to accomplish, and I'm gonna do what I need to do to get there. I love that. Well, congratulations to her. Come on, y'all, Texas, because we need everything that we can get down in Texas. Don't get me started. Okay, never mind.
Some information, some questions with it to help.
Of course you did. Of course you did, because that's who you are. Of course you did. Okay, so before we jump in, let me remind you, if you are on Clubhouse, share the information. Tell somebody to join you in the room so we can have a conversation. But we want you to join in and add to the conversation. So don't be shy. Just raise your hand and we will definitely bring you up to the stage. Your opinion matters and is welcomed here. It's all about the conversation. So join us in the conversation. For my Facebook, YouTube, and LinkedIn friends, you all know what to do. Y'all use the chat religiously. So keep doing what you do in the chat. And if you have a question, just put a Q in front of the question or before you place the information in the chat so we know it's an actual question and we don't miss it. Okay? All righty. So first things first, let's church announcements. So y'all know it's April 1st and there have been some updates in the ICD-10-CM as well as PCS that are effective today, April 1st. So there are 42 ICD-10-CM additions. There were 7 deletions and 1 revision. Also for PCS, there are 34 code additions, no deletions, and no revisions. Don't forget to also peep the guidelines. There are a few changes over in your guidelines that were updated for April 1st as well. Church announcements. Don't be caught out there posting and putting the wrong codes because you didn't know that now codes are updated twice a year instead of just in October. It's also April and October. Something to put in your toolbox if you didn't know. Okay? All right.
Check those dates of service.
Amen. Amen. Okay. So let's get this party started. So for those who are joining us today, we have a special guest. Joining us today is Miss Davita. See, I'm about to butcher the whole name. Davita Graham, who is a mom, a wife, and nurse practitioner in that order. Okay. But she has a whole lot of information, a whole lot of expertise, and a whole lot of tea to spill today. So you already know our resident nurse, the coding nurse, and Miss Davita about to just take over the airwaves over here today and drop some knowledge and spill some tea. So let me bring Miss Davita in the room. Yay. So welcome her. Yay.
Thank you for having me, guys. I appreciate it.
Yes. Also, and you guys in Clubhouse, let me know if you could hear her. Oh, Dr. Talk said I failed my exam twice. I gave up. Ma'am, we need to have a conversation. Because we can get you there. We can get you certified, ma'am. Okay. Let's see. So I'm sorry, I got caught up in the conversation. You know how I am. Our conversation today may motivate you to try again. That's right. So Miss Davita, I will let you introduce yourself. So tell the folks who you are and all about you.
Okay, you did a pretty good introduction at first, but my name is Davita Graham. I am a mom of 5 and a nurse practitioner based out of Philadelphia, Pennsylvania. I currently focus my work in urgent care as well as primary care. I also have a LLC called the DOT CRMP, where I do DOT exams for the Department of Transportation for CDL truck drivers so that they can maintain their licensure. And I'm a big nurse advocate. So the advocacy is the reason why I'm here today, to talk about, things that we can do in nursing to improve nursing for nurses as well as nurse practitioners.
Cool. I'm excited. Yeah, we've been talking a lot about the shots fired over there at the AMA, even though I'm gonna be real honest, it was Doctor's Day the other day, and I do have some doctor friends.
Me too.
I don't think they are part of some of the foolishness that I have been reading from the AMA regarding their bullet list on or hit list, if you will, on the things that they want to accomplish in their initiatives this year. But yeah, we still got to talk about them and address them. And if they are, then we coming for you too. All right. So, Mr. Jesse, I'll let you take it away.
Well, I have been a fan of Davida for a minute because she is a true advocate in every sense of the word. And I enjoy her sharing her knowledge. And I just really wanted Davida to come on today because we know that healthcare has changed.
Yes.
And we know that from a clinical standpoint, the old guard is dying off. There has been a paradigm shift in healthcare, and they are fighting it tooth and nail. And they're not going to win because progress always wins.
Right.
I just really wanted, what I was curious to know from Davida's standpoint as a nurse practitioner is it seems like the AANP is so much more effective in advocacy, especially in terms of full practice authority. And that organization is so much more effective. When I went to their website, like they really put advocacy in the forefront. It's a great organization, but I just wonder, in your opinion, how come the AANP can be effective in advocacy, but the NLM can't be effective in advocacy?
Well, I do think that lack of advocacy as well as lack of effective lobbyists are a problem in nursing. One of the reasons why is if you look at physicians, a lot of times they have national organizations. The problem with nursing is that we are so state-based. So it's hard for us to get that national unity because everything is different in every state that you go to. A lot of times nursing policies are dictated by the state. So the way that we practice, varies from state to state. So to gather us all together to be on the same page is hard. We need a national organization that everyone can be involved in that not only brings us together to educate, but also is staunch on activism and lobbying. See, doctors have lobbyists, and those lobbyists are able to speak to politicians and run their agenda. People don't realize healthcare is just like any other big business. A lot of it is based off of policies and laws. And we're not as politically savvy as nurses to understand how that affects our day-to-day practice. A lot of times you always hear, nursing is a calling. You're here for that. And that's true. I do think that a lot of us have a calling to help people. But in the same token, because it's business and political, we have to understand that aspect of nursing too in order to create changes. The AMA is very effective, and that's why we still have states that don't have full practice authority. I live in, you know what I mean? And we have a lot of laws on the table. In fact, we had a full practice authority law on the table since 2019, and it still hasn't passed the House because it doesn't have the backing, which I'm confused about because it would help and open doors for so many nurse practitioners as well as patients. People don't realize that the full practice authority helps us run our own practices, but in areas that I work in that are urban, that are losing hospitals, that don't have access, If you give that authority to nurses to be able to open their clinics, maintain their financial freedom, reach populations that, healthcare facilities or doctors don't want to go back to, in a sense, you create more access. And to be honest with you, when you're dealing with underserved populations that get lost in the healthcare system anyway, you really want people that are going to look at the whole person. And that's what nurses do. We don't just disease focus. Like, we are looking at, are you getting enough food? Can you afford your medicine? What's your stress level in your life? And so minority patients need that extra, because that extra is how we create equity. If we don't raise the bar for underserved populations to bring them up by doing that extra, we've not created the equity we need to make sure that minorities and underserved have positive outcomes. And full practice authority will allow nurse practitioners to do that, not only in urban areas, it's effective in rural areas as well.
That's what's up.
Especially with the closure of all these critical access care. I mean, it's all over the country. And believe it or not, I can't believe Pennsylvania is so resistant, because a lot of Pennsylvania is rural.
It's so bad. We lost so many hospitals in the Philadelphia region. They closed St. Joe's, they closed Hahnemann, they closed Mercy, Philadelphia. Then it started trickling out to the surrounding areas. They closed Springfield Hospital. They closed Delaware County Memorial. They closed Brandywine. Now we got 1.5 million people in this area, and you've closed at least 7 hospitals. Now, granted, the larger hospitals, the university hospitals, are still open. But when we have inequities in healthcare, then that means that lack of access is going to be detrimental to the outcomes of a certain population. And we already know who that population going to be.
It's going to be people that look like us.
Right. You know what I mean? And so it's imperative for me, because like I tell patients all the time, people all the time, although we are healthcare workers, in an instant, we can be a patient. You understand what I'm saying? So changing healthcare actually affects us all. Like, we don't get a pass because we're in healthcare. If we are black and brown, and we go into a environment with lack of access or healthcare biases, we're going to have the poor outcomes just like everybody else that looks like us, unfortunately.
So your organization, Nurses United for Change and Equity, is that just for the Pennsylvania area, or is that a national organization for all too?
So right now, just primarily in the Pennsylvania area. And one of the reasons I started it was because during COVID, the area that I lived in didn't have a health department, which you said you're going back for public health, was shocking to me. I'm like, what do you mean it's no health department? My concern was to the young mothers who, may need that as a resource, being pregnant, or people that don't have insurance. It just behooved me that my area didn't have that. And so what was happening was it was hindering access to COVID vaccines. So originally I started the nonprofit to do that. But as I started engaging and really looking at the politics of healthcare, when I started the nonprofit, I really got close to my local politicians and really started understanding how politics work and getting politically savvy. And that's when the gear towards just helping out with vaccines in the community change more, for trying to create change and equity in healthcare for minority nurses as well as minority patients.
Okay. Hey, Dr. Talk, welcome. Cool. Well, thank you for that. Okay, Mr. Jesse, I'm sorry. I was just curious.
Okay. Now, there has been hit pieces put out by the AMA for a couple months, really coming at nurse practitioners. And it's really, I found it insulting, and I'm not even a nurse practitioner. And what they had coined this term that I thought was very funny. I mean, it was hilarious. aside from the one that we had last week, Larry, but this one was really, they called it scope creep.
Mm-hmm.
And they were basically trying to imply that nurse practitioners were overstepping their boundaries as a healthcare provider in terms of when it came to medicine. And I found that to be very insulting. And I just wanted to know, what is your opinion as a nurse practitioner when it comes to the term scope creep?
Now, I'm gonna be honest, it's definitely so. Not only do I think it's a campaign against nurse practitioners, I also think it's a campaign against nursing. I think it's a campaign against the entire nursing profession, period. What I will say about medicine and the AMA and all of that is almost like it's the good old boys. You understand what I'm saying? And like you had said before, the guard is changing. I mean, we have more minority doctors coming in who are going to have a different mindset just because of their backgrounds. You have a lot of younger physicians that don't share some of those same goals. So I do think that things will eventually change. I think it's really a threat. You understand what I'm saying? And it's a threat on many levels. So first, we get the argument that nurse practitioners are not as educated. And I always like to visit that. And one of the reasons why is because you have to look at how you enter into being a provider. It's three main providers: nurse practitioners, physicians, and PAs. And they all lead you to the same endpoint of being able to prescribe, treat, and all of that. But your reasonings in picking that path have differences. So a lot of times nurse practitioners, the way the curriculum is set up, you're supposed to be a nurse first, a bedside nurse that has worked for at least 5 years at the bedside, because in reality, even though you're getting paid, that knowledge that you're learning at bedside is taken as part of your expertise. So when you get into the nurse practitioner program, it's not starting at the beginning trying to teach you how to be a provider. It's based off of the fact that you're already a provider as a nurse. Let's build on those skills. So it's almost like if you come out and you're a nurse and you haven't did that bedside, you're probably not going to be successful as an independent, autonomous nurse practitioner because you didn't meet that previous criteria of being a registered nurse at the bedside for, in my opinion, at least 5 years to gain that skill set. Now, if you enter in as a PA, which doctors like, because PAs practice under the medical model. Let's not forget, nurses, we have our own model, the nursing model. So as a nurse practitioner, I don't practice under the medical model. I still incorporate the nursing model in the way that I practice. PAs practice more so under the medical model. And the way that works is that to be a PA, you can graduate with your undergrad in particularly almost anything. Now, a lot of them do want you to have a background where you've done some medical training. I'm not sure about the hours because I'm not a PA, but that medical training can be in anything. You could be an EMT, you can be a CNA, and I don't know the stipulations on that. But then the curriculum is set up to teach you like you have no healthcare knowledge. So you're going through the PA curriculum, learning everything that you would need to know to be as a provider, unlike being a nurse practitioner. But to understand that, you have to know the entry points and what the requirements are. A lot of times they try to say, well, our education is not like physician assistants. Right, but a physician assistant also doesn't have 5 years of clinical experience before they go in to be a physician assistant. You see what I'm saying? Mm-hmm. And so because they're tied to them and they always have to collaborate with them, physicians sort of almost promote you to be a PA, and they promote PAs instead of nurse practitioners. And that's also because of the autonomous part, because in some states we have to collaborate with the physicians, but you have plenty of states in the United States, I think 26, where nurse practitioners can function independently. So I think that doctors like that control because then they can dictate how you practice. But let's remember, The nursing model isn't for everybody. It's failed some of us. Let's be honest. You understand what I'm saying? And that's not being rude. That's not knocking the medical model. What it is saying is that the nursing model and looking at the whole person is more suited for certain populations than the medical model is. So we're not being as disease focused. We're not only talking about your disease, we're also delving into the rest of the aspects of your life that may be hindering you from getting to a place of compliance or a place of better outcomes or better understanding of your disease process, because as nurses, we take that time to incorporate all of that in your treatment plan. That makes a difference.
Yeah, like involving the social determinants of health, understanding where there may be challenges. Whether their health literacy is another one that comes to mind, where where folks understand what's happening and what they need to do, and not whether or not they I was having a conversation with somebody the other day about health literacy, and I was like, it's not about whether or not they could read. It's not that, it's bigger than that. So understanding, if they understand the disease, what happens, what happens as the disease runs its course, and what types of things that they need to do to stay above that disease. So yeah, it's all of those things.
Right. And I tell people all the time, health literacy, one of the key major components of that is you learning how to maneuver that healthcare system. That's pretty important. Like knowing when to go to your PCP, when a specialist is important, when to go to urgent care, when ER is important. All of those things are pretty necessary with health literacy. Educating on how to maneuver accurately in the healthcare system is key as well. And just to go back real quick on the physician side, another reason why you get a lot of pushback is because a lot of times in states where we don't have full practice authority, we've created an income source for physicians. So it doesn't stop nurse practitioners from opening their practices. I have plenty of friends that have IB med spas that have their, own practices. I just won't do it because with 5 kids, I can't afford to give you a cut. I need all mine. You know what I mean? Amen. And so you have physicians that are signed up as medical directors for nurse practitioners' practices, and really all you're using is their name, and they're getting a cut. Like you're paying them a monthly fee for them to do that. And even as nurse practitioners who don't have a business, sometimes you're forced to do that just to practice, because we have to have a collaborator on file. And I'm going to be honest with you, I never talk to my collaborator. They're just on file for paper. I'm such an autonomous nurse practitioner that I really don't have to call you, because if I do need anything, I know how to get on up to date. I've been well versed in research, so I know how to look for a research article that may point me in the right direction. So I rarely even use them to collaborate in that nature, just because I have that independence and that sense of autonomy. But a lot of them, it's like, well, no, this is a steady income that I get pretty much for doing nothing. I don't want this to go away. And when you have states that have big lobbyists like PA, like Texas, they're going to remain not full practice authority because they have those physician lobbyists fighting to stop that. And then they come up with all the excuses why. Oh, it's lack of education. Oh, they're creating poor outcomes. Oh, they don't understand, they order too many tests. They have a box that they pull from of all the excuses why, but I can pull from a same box that shows you that nurse practitioners improve access, nurse practitioners improve outcomes, nurse practitioners, educate better. So, it goes both ways. Our voices as nurse practitioners aren't as heard, though, because number one, we don't rally together and stick together like we should. And number two, we don't have those political lobbyists.
That's good. let me just pause and let the friends of health information also know that she has some roots. She's a family member. She has some roots in health information as well.
I said I started out as a medical biller way back in the day, but I told her that's when they were doing like UB92s and HIPAA 1500s. You know, that was back way back.
But we also both understand and agree that having that skill set as your own independent practitioner or in your own practice helps you understand how to follow the money and where the money resides.
Absolutely.
And all of those things as well. So you get a better understanding of, documentation, understanding the importance of documentation, and making sure that all of the elements and the information is there in order to bill and be reimbursed for your services. So she is a friend of the family, y'all. Okay, Mr. Jesse, did you have any other?
Yeah, I wanted to circle back to a couple of points because for me, I also believe that is also related to sexism because there are and I really do believe that there is a sexism. And also when it comes to money, because everything comes down to money, you know, they do have an incentive to keep a collaborative agreement because they can see if you have 3 nurse practitioners working under you, you can see 4 people at the same time and get billed 100%. And it's really interesting that people don't understand the back end, really understand why all of this is going on. Well, part of the reason why it's going on. And also about the education. You know, it was a time when and there was a time that, like you said, you really did an NP program, you had to be an RN for a certain amount of time. And that doesn't seem to be the case anymore. You have people who are going straight through. And given the way clinicals have changed, and a lot of new RNs don't have the clinical experience during their training to even function as an RN, let alone to go straight into an NP program. So, do you think that the program the requirements need to go back to how they used to be, or how do you see that being worked out to have an RN who wants to become a nurse practitioner get the skills that they need and then go into an NP program instead of going straight through?
Well, that's a twofold question because part of the problem with that is degree mills. So let's keep it 100. Everything has become based off of capitalism, and that includes our educational system, especially our higher educational system. So a lot of that hope goes back to them maintaining the standards that they used to maintain before on allowing people to even matriculate into the nurse practitioner program. So that means that these direct entry programs that are allowing nurses who just passed the NCLEX 2 months ago to now enroll into MP school, they actually need to be dealt with. And that's where I say that nurse practitioners and nurses need lobbying groups that are able to be political heavy hitters and say, hey, this is something that's, bad for our profession. We need to try to go after these degree mills and stop them. Now, we've seen that happen with the whole Florida scandal with the nurses, with the fake nurses down there. I don't know if that was more a smear campaign, but something similar needs to happen to these degree mill schools because they're all over the place. And we need to really address that because I do think that that's a hindrance in the profession. I do think that not having that background and now becoming a nurse practitioner where you can prescribe, treat, come up with interventions, read labs, and you've never worked bedside to gain that experience, which is key in the MP curriculum. On that note, I do agree with physicians. I put the work in. You know what I mean? I was an ICU nurse for 8 years. I had my master's degree in public health nursing before I became a nurse practitioner. So I had a rich background so that when I did start prescribing and having, coming up with interventions, creating treatment plans, I had already been exposed to this for years and years. Now, what I will say is I'm not going to knock young people for wanting to be a provider. We need providers out here. We have a lack of access. But that means to me that if you're a nurse and you haven't worked bedside and you want to become a provider, the PA curriculum is set up for that. You understand what I'm saying? It's set up for you to not have a bedside background, for you not to have practice prior, and you can come out and be the same thing I am as a nurse practitioner. Now, the difference is your hand is held a little bit more because you must collaborate as a PA. You don't have autonomy. And I don't know if that's what steers newer nurses to go straight into the nurse practitioner program, or it's actually less work. If you have that background of the years put in with work, the way the MP curriculum is set up, you may go to school for 2 years and then you're a provider, versus that 3 or 4 years learning everything as a PA. And I think sometimes people want the quick result, but they're not realizing that as a provider, that you have to also remember liability. You have to also remember that, you're now making medical decisions that can really primarily affect somebody's life. And, they sue nurse practitioners. We carry a $1 million, $3 million aggregate on insurance. And that's what I'm worried about with these degree mills, is that if you keep on putting these nurse practitioners out that don't have a background and that aren't versed in what to do, then our liability insurance is going to start going up. And remember, that's what they did to the maternity doctors. And a lot of them said, you know what, I'm out. And that's one of the reasons why we have this big maternity access issue and these poor maternity outcomes. So that's why I fight so hard about the nurse practitioner profession, because I know if they smear us, if we go away, then it's a population of people in rural environments and urban environments who are truly going to suffer. Because as much as these physicians fight, they not coming back to the hood opening practices.
That's right.
They not in Nutbush, Tennessee opening practice. You understand what I'm saying? So, why would you want to decrease that access for populations of people that you're not worried about anyway?
Right, exactly. And you have to think about the motivation for that, or the motivation behind that. Like, really, why fight for that? You're not coming in. Do you not want these people to have health care? Do you not want there to be equitable care for them in these particular reasons? Like, you got to, me, I'm always thinking about the why.
Why behind what's going on. And it's definitely several whys. I mean, like I said, the financial aspect of wanting to keep a paycheck. And let's address a lot of times the elephant in the room is egos. A lot of times people become providers because of those egos. But like I tell people all the time, correct. Like I tell people all the time, in healthcare, that can't be part of healthcare, because it's not about you. It's about those patients and those patient outcomes. And so, who a lot of times people will see if you're a strong nurse practitioner, if you're able to relate to patients, if you have positive outcomes, that's a threat sometimes to people who are in it for the wrong reason. And you have a lot of that also. Remember, my grandpa was a physician. Now my dad was a physician. You have a lot of that in medicine.
Yeah.
Nepotism in medicine.
Yes. Listen, I'm not mad at it. I'm trying to get down with it. My daughter in nursing school, like, come on, we gonna do it too.
Amen. Amen. We do it on a different scale.
Amen. You know what I mean?
So we get in as well, and have viable, long-standing businesses and opportunities for our children and children's children. So
absolutely,
I feel you. That is wonderful. That's wonderful. Let's see. Michelle said, good morning.
Good
Good
morning.
morning. The healthcare business consultant Michelle said, the healthcare system I work for, the physicians are constantly admitting patients to inpatient and to OBS, and we get a lot of denials from Medicare for this, and they just don't want to listen. Exactly. And she also says a lot of them are money focused and want to brag about their credentials. They are not focused on patient care. You are absolutely correct.
Yeah, I see that a lot.
Absolutely. Wow. Yeah. So I know we took it quite personal when we first saw the information and article from the AMA. I'm like, I'm not even a nurse, but it just hit my spirit just the wrong way. Like, why are they attacking them? And so I appreciate you kind of laying out the whys, if you will, of why they would want to come after nurse practitioners collectively to kind of dissuade those who are thinking about becoming nurse practitioners and stop those who are nurse practitioners from getting full practice authority. That was really a great summary on that. So as far as your advocacy efforts and I know you are working primarily in with Pennsylvania, how are you guys go? I mean, are they listening? Do you have a large AMA or physician presence lobbying against you all? I mean, is it a big fight in Pennsylvania?
Yeah, it's a big fight because I tell people all the time, Pennsylvania is a purple state. I mean, really, the only blue areas are Philadelphia and Pittsburgh. And
Okay.
if we don't come out in droves, we red, baby. You know what I mean?
Ohio is the same way. We got Cincinnati,
And
Cleveland,
so
and
a lot of people don't understand that, being that it's a up north state. But yes, and then you also have to realize Pennsylvania is a big hub for medicine. Like, you have a lot of people coming to the Northeast region to get their education in healthcare, and then they sort of branch off when they're done and go back. So that presence of all of those physicians in there getting their education, that sometimes helps push things over. And yes, they have huge lobbyists. I think a lot of what I think in my state is the problem is that we don't have the unity as nurse practitioners to come together to have those voices. And I try to stress to people, sometimes it's a matter of, knowing your local politicians. A lot of people think that political moves are made on the federal level, and that's not true. The political moves are made on the state level. So, know your local city council, your state reps, your state senators. Be in their ear, write them, have personal stories on how gaining full practice authority will help you. Same with nurses. We have a patient ratio law. Explain to them what having better patient ratios looks like for you as a provider, and what you don't have now, how that looks. A lot of emailing, mass emailing, mass calling. When you do that, you get the politicians' attention, and they look better at whatever bill or law that you're talking about. I had a politician friend who actually told me, I had no idea how the hospital worked. They don't know. They don't know the inner dynamics of how hospitals know. All they know is what the physician lobbyist or whatever lobbyist is coming in their office, sitting down, talking about. And so we have to, if we can't get lobbyists, we as constituents have to be in their ear and really talk about the benefits of full practice authority, safe patient ratios. We have to get involved with that a little bit more. That's one of my main focuses.
I agree. And I think it's also very important to know where they stand and what their positions are.
Right.
I say all the time, your vote matters. You can't sit out on these elections just because it's not a presidential election.
That's
and then
right.
not vote, because everything doesn't necessarily, to your point, everything doesn't happen at the federal level. Things happen in your local elections that are important to you, not only for you where you live, but also where you work, and now also where you practice. So you have to be engaged and have an understanding of what's going on. And also, to your point, and I know I advocate for health information, they pay attention and they listen when they hear from their constituents.
Yes.
They want to know because one, they want to keep that vote. And if you're talking to them or asking them questions, then it gives them the understanding and the impression that others are talking. They may not reach out, but this is a topic of conversation that is being had, and they need to understand, what's happening. Why are they talking about this? What's going on? I need to be well versed in order to address them in that situation. So it is very important that we stay connected. We hate to believe this, but everything is political. Everything
is political. And to go back on when you were talking about the nurse practitioners, so nurse practitioners really need to keep their eyes open, because in the last 2 weeks, I have been keeping my eyes open, because it's 3 levels of advanced practice nurses. So you have nurse practitioners, you have nurse midwives, and you have nurse anesthetists, and some states have CMEs. So those are all the levels of nurses that write and prescribe. And you and I were having a conversation recently in the last 2 weeks. Indiana University, Arnett, and Fayetteville, they actually made a big move against nurse midwives. Right. And they stated that the nurse midwives will no longer be able to deliver babies at that hospital, that they will only be able to function in the outpatient status, which is a hurt piece, because their scope of practice is prior to delivery, during delivery, and after. And they stated that some of the reasons why were that physicians were uncomfortable with the practices of the midwives, which was horrible. I did like a little article on it, and the nurse midwives were unhappy, and it's almost like they teetered with the scope of practice to make it fit what they wanted to fit. And once you start something, as other people, other states, they got away with it.
Right. Organizations, even at the
once you see one chess piece move, it's time to really get on point, because right now it may be the certified midwives, but you best believe they sitting around somewhere trying to figure out, how can we apply this to the nurse anesthetists? How can we apply this to the nurse practitioners?
That's right. Wow. And for it to even be down to the facility level where they are changing their whole policy to determine someone's career move.
I'm gonna tell you, the facilities are really slick, because even if you're not in a full practice authority state, if you work under a hospital system, it's almost like you are. And the reason why is because what you said earlier. So if you just allow the nurse practitioner in the hospital system to sign off on their own notes and make their own decisions, you only getting that 85%, right? Exactly. And we know that these hospitals, whether or not they in full practice authority states or not, they want that 100% reimbursement. That's one of the reasons I don't work in hospital systems, is because they're going to skim you off the top and make you collaborate with somebody, if not for nothing else, but to bill that 100% and get that reimbursement.
That's right. And they have models set up exactly for that. And we could talk forever. and some of their RVU models are more advantageous to the physician, because the nurse practitioner is doing the work. However, the RVUs go to the physician and helps build their RVU levels, which help them in their bonus tier structure. So it's bananas. It is bananas.
But see, like you just said, like we just had that conversation, I wonder how many nurse practitioners don't even realize that. Right. You know what I mean? Like, a lot of people get their degrees, they just go to work, but they don't understand the inner workings of their profession. You understand what I'm saying? So they walking around, I'm in a full practice authority state, but really you working at, whatever hospital, and you're not functioning at that capability.
Exactly. And you would think, even if they don't have the mentality or the mindset or the goal to practice on their own, they should even still be in the trenches and advocating for those who do, because it opens up opportunities for them in the event they want to go that route. So
Right.
you may be at the hospital right now and thinking that this is all above or beyond you. However, something may happen that will cause you to say, you know what, maybe I can consider or think, or someone you know may be thinking about. So you need to still be in the trenches and advocating for your fellow nurse practitioner.
Absolutely. You
In your
never know
state.
where the wind gonna blow you.
That's right. And we all saw with what happened with COVID and how opportunities opened up for nurse practitioners, opening various types of businesses and entities that allowed them to stay afloat and continue to feed their families and be viable folks in the community.
Absolutely. I'm gonna tell you something. Even me starting the vaccine program, originally I thought the vaccine programs were only going to pharmacists and physicians. It took me actually getting my state's vaccine provider agreement and reading the entire agreement and seeing that it said, well, anybody can, apply to become a vaccine provider as long as your licensure allows you to give vaccines. Well, who is that but a nurse?
But a nurse.
So like I was one of the first nurse practitioners in my state to become a vaccine provider. And everybody, well, how you do that? How you do that? And I was the chief medical officer. I was like, well, if you read the application, you didn't need a collaborator or a physician to be the medical officer. You could have been a medical officer yourself based off of the scope of your licensure.
Look at that tea that's being spilled right here. Just hot tea. Look at that. And so you also talked about your .crnp business about providing physicals for CDL truck drivers. Can you provide a little more information on that? And you mentioned it was a kind of a I'll say easy, but not necessarily easy, but easy startup for nurse practitioners who are out there looking for opportunities to branch out.
Absolutely. So the Department of Transportation, which is federal government, they do physical exams for CDL and truck drivers. Now, once you become a nurse practitioner, you take a course, and then the same way you sit for your NCLEX or your nurse practitioner boards, you would sit for a board in order to become a certified medical examiner for the Department of Transportation. Mm-hmm. Now, a lot of people also don't realize that when it comes to full practice authority, federal government automatically gives nurse practitioners full practice authority. So if you work at a VA hospital, even if you're at a VA hospital in a state that doesn't have full practice authority, you automatically have gathered that based on, based on the federal government guidelines. So when you're doing the Department of Transportation physical, is under that umbrella. You have your own license and you could work that way. So it's a couple of things. So I started an LLC. I always recommend any nurse practitioner, start yourself an LLC, because if it ever gets tough and you need to, you can always work 1099. You know what I mean? And you can always generate an income like that. So started my LLC. I actually learned how to do DOT exams from an urgent care that I worked at. They paid for me to get certified. But I really started watching the inner working. So first of all, not knocking any billers, but it's cash money. So they paid cash for these exams. There's no insurance, nobody's billing. So that's one positive. It's low overhead. You don't need too much equipment. You need an exam room. You got to do some urine dips, but nothing real, eye chart, but nothing that's really expensive that you need to invest in to start. If you can't get a space, like I said, having that LLC is a great way for you to be able to contract yourself out. So, bus companies, school buses, truck driving schools, all these places need DOT exams. So it's a wealth of outreach for you to be able to do. And if you're somebody that can relate to patients, can educate, because education is a big key, you really gain the trust of them. They're blue collar, workers. And once they trust you, they're going to come to you all the time, and their loyalty is key to establishing a business. So I really do think as nurse practitioners, that is a way that you can, create your own business revenue, and it's sustainable. So for me in Pennsylvania, because we don't have full practice authority, I told you, I'm not paying a doctor for me to, work and do my job. I'm not doing it. So I'm 1099. I have my LLC, the DOTC RMP, everything goes under that. And I go around, and whatever office will say, hey, I need DOTs. I do them a couple days here, and I get 60-40. So there is a win for them. It's a win for me, and we keep it moving. So, sometimes it's best to just create the independence. For me, I'm too much of an advocate to work in healthcare systems, facilities. Like that didn't work out for me, because when I saw something wrong, I was too outspoken. You blacklisted right away. So for me, it was like, okay, well, this is another way for me to generate income on my own with my own license. And I just circumvented the process. You see what I'm saying? So, it is a way to do that. And for those that are in full practice authority states, excellent way to have their own business where they're generating their income, cash based on the volume of patients they're doing those DOT exams on.
That's what's up.
No prescribing, so that's positive. You don't prescribe meds, but you do have to have the clinical thinking, because when it is a problem, you have to know, can I cert this person, or is this person a safety issue on the road? So you do have to have the background knowledge, but the liability is also decreased because you're not prescribing any medication. So it's a win-win for me.
That's what's up. That's what's up. Thank you for that information. Now, I ain't like that y'all don't have anything to code or build. but it's a win-win for y'all.
But I will tell you, it is a lot of people that incorporate doing DOTs into their regular practice. For those that may be listening that have their own practice, a lot of people will just, that's one of the services they provide. So they may do wellness visits, primary care, but they're DOT certified, so they can, bring somebody in, and that's another service that they provide.
I appreciate you. I do. I appreciate you taking the time to come and talk to us. And, I always talk about how there's so much knowledge, there's so much information, there's so many people out here doing the thing. And, we as Black folks, we'll invent the wheel. Do you hear me? We'll make whatever happen. And understanding. And really, it really comes down to reading, because, reading is fundamental. If you read some stuff, you can find out some stuff. I believe they put stuff in books for us not to know. But when you read things, you can find out things. And so I am so appreciative that Mr. Jesse talked you up to me last week.
Yes, I enjoyed it.
He was like, excuse me, ma'am, can we talk after the show? I got something for you. I said, well, let's talk. I said, we'll make everything happen. And voila, in less than a week's time, we made some things happen. So I appreciate you spilling all of this wonderful tea. Mr. Jesse, did you have any additional things that you wanted to add or questions you had?
I've just enjoyed this entire process. And I just wanted to add, Clarice, I do agree on one thing. I too have a CDL Class B license.
All right, sir. I should have known. I should have known. This man, I swear he does it all.
So you gotta come see me, Nurse Jessie. I got you.
I used to fuel trucks at the airport. I used to fuel airplanes.
Okay.
What didn't he do? So I'm gonna start asking you, like, what don't you do? That's gonna be the new question. Not what do you do.
I'm glad he got that CDL still in his pocket. I tell everybody, once you get certifications are the key. You know what I mean? Certifications are everything to all the nurses or anybody that can get certified. I don't care if it's, what do they call those people like that stamp everything? Whatever kind of certification you can get.
Notaries.
Yeah. A notary, they are all key. Get certified. That is the key to independence. I promise you that. And marketability. I promise that.
that was some scorching hot tea right there. I love it. I love it. This was fabulous. I am so excited that we had an opportunity to meet you. You know, you're gonna be definitely a fan of the a friend to the family.
Thank
Be
you.
inside the
Anytime. I enjoyed it.
as a resource. So are there things, if people want to reach out to you, if there are things that you got going on that you want to direct folks to, I will give you the floor to invite folks to your sites or the advocacy, whatever it is you want to.
Okay, so if you're in Philadelphia, PA, you need a DOT exam, you know, any truck drivers, I'm at Megan Medical on Mondays and Saturdays. You can always look them up and call them to find out. And then if you're interested in becoming DOT certified, or if you're already DOT certified and want to join a group of nurse practitioners who are involved in discussion concerning DOT exams, you can follow me or request on Facebook. It's called DOT Provider Forum. My my TikTok, where I do a lot of advocacy, talking about healthcare news, things that are going on with nurses and nurse practitioners, plus a little bit of fun and laughing, is the DOTCRMP on TikTok. On Facebook, I'm Davita Graham, and on Instagram, I'm Smarty B. I always take inboxes if people need mentorship questions. I'm not that nurse influencer that doesn't get back. I enjoy engaging. So please feel free to follow me, inbox me, ask any questions.
I appreciate you. I do. And I have look, I'm gonna be in your inbox. You're gonna be like, what? Wait a minute, I got your number. So
right, exactly.
I can circumvent all of that. I can get you directly. No, this was wonderful. Yes, I do have a couple of questions, because that whole advocacy piece, that was that nonprofit advocacy piece, you done pique something in my spirit.
Okay.
So definitely
please hit me up. Feel free.
Conversation about that. Mr. Jesse, what's going on with you, sir?
I really just enjoyed this, and I know Davita is very, very receptive to people reaching out to her, because that's how I really first came to know her, because there was some situations with nurses, and there was a nurse here in Philly who was impacted, and Davita was like, well, how come nobody's reaching out to her? Because there was another nurse who was not in our community who got all kinds of outpouring.
Yeah.
And I reached out to Davita to make contact with this nurse to see if she wanted my assistance, and she did. And I offered her my coding course.
And let me just say this, because it was a situation where when I said they coming for nurses, they were really coming for this young lady and really stripped her of her nursing license for a little bit, and she got charged. And when Jesse reached out to help her, it was just like, you know what, here's a community. We're all in the same community, and we're making sure that somebody is okay. Like, I was the emotional support to say, hey, you're not alone. Like, I have your back. And then for Jesse to come in and offer her a way to still maintain an income, that is what we need to do as minorities, as a profession, as human beings.
That's right.
And I remember I told you, Clarice, like instantly when you said his name, that's what I thought about, because we have to move that way. And and just from that, I knew who you were, Jesse. That was a wonderful thing you did.
That's right. And that's you know, he's part of the fam. And I felt that love, even though we didn't meet when I came to Philly. I still felt the Philadelphia love. I came all the way to Philly to have our show. And I felt the love of the people. It was fabulous. I had never been to, well, I've been through the airport, but I had never just been in Philadelphia and got to see the sights. And we spent the whole weekend there, and I had a fabulous, fabulous time.
I'm glad.
Yeah. So I love that the bell was rang, and folks rallied around and did what they needed to do to help her out, because it could have all went a whole totally different way. And she could have, at some point decided this is not for me, walked away, just threw in the towel and all of that. But having a wonderful support system of professionals who walk the walk and know what they're talking about and doing what they want to do, and who sacrificed and provided information. Because if she's stripped of her license, I'm sure she didn't necessarily have funds to do XYZ. So just being that person to share your resources, being a blessing to bless somebody else, is just, I love it. I love
Me too.
All y'all Philadelphia, she said she's a proud Philadelphia. All of y'all taking over. We neighbors here in Ohio, but y'all taking over. Y'all taking over. I love it though. That's what's up. That's what's up. All right. Well, we are at the top of the hour. I don't want to keep Miss Davita all day, even though I'm sure we have lots of things.
We can talk all day. But maybe we could do this again. I really enjoyed it.
Definitely. I know you are busy. On top of busy. I thought I was busy, but I was like, oh no. Between me, you, and the man that does it all. But maybe we can figure out, what our schedules look like, and then have you on regularly. I would love that.
Absolutely. That would be great. I would love it.
That would be great, especially as we're migrating through all of this foolishness as it relates to advocacy and trying to stop the flow of progress as it relates to nursing. And because we know in our community, we have a lot of people that go into the nursing field. They may start out, as CNAs, but they usually progress and go all the way through. It's something that, they'd be like, well, I'm a nurse. And sometimes they get stuck in one area, but here are faces that look like you that have gone into different arenas in nursing and morphed it to different things. So there are all kinds of opportunity. Mr. Jesse talks about it all the time as the coding nurse. There are other things that people can do to assist and generate income and businesses and all of the things. So yes, you got some folks right here, resources that can show you the ropes and assist you in your endeavors. So I appreciate this. This was so good. Oh yeah, my spirit is full. So thank you all again for joining the Saturday morning tea. Let me ask, was the tea spilled today? Was it spilled today? I mean, it was some piping hot. I thought I was going to get burned a couple of times.
I had my cup with me.
Damn. I'm double bagged. I should have been triple bagged. Yeah. So if this information was valuable for you, help us share this message with others by liking the video, sharing the video, and subscribing to the channel. You can also check out the Coding Nurse channel on YouTube. We are the Professional Reimbursement Network. Mr. Vita, I don't know are you on YouTube as well? Do you have
No, you know what? They trying to get me to get on YouTube because we might be losing TikTok, and that TikTok is my better platform because I'm toned down here, but sometimes I get a little raw. And I can do that over there. But they telling me to go. I might check it out and try. We'll see.
We may have to collaborate on that because I have no idea about the whole TikTok. I'm like, I think I have one TikTok video probably on my whole thing because I'm like, I don't even know. But yeah, so we may be able to collaborate on that.
Okay, perfect. I look forward.
So last and certainly not least, to my Clubhouse folks, make sure you click on the greenhouse to join in on the fun that happens in our club. And you will also be notified of our live broadcast, which happens every Saturday morning at 9 a.m. Eastern Standard Time, the Saturday morning tea. Again, this has been a great session today. Thank you all for joining. And remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care. Have a great weekend. Bye-bye.
Bye-bye.